Hello, my name is Lil Anderson, and I am Chair of the Board of the National Association of Community Health Centers. Today, our health center membership, along with our state association partners, are gearing up to implement and execute a bold new initiative, offering our model of healthcare as part of the solution to the growing crisis in America's healthcare. Access for All America is our plan to preserve, strengthen, and expand the community health system into the future. It is a plan that calls for strengthening the health center foundation as we continue the momentum for growth to serve 30 million people by 2015. It is based upon our vision and our mission to bring health care to all of America's medically underserved. As health center board members, administrators, clinicians, and staff, we all can attest to the needs in our communities and the grave challenges the nation faces, with 47 million people uninsured and millions more who are underinsured or without doctors or a healthcare home. At the same time, we can attest to the tremendous success America's health centers, our health centers, have made in helping this nation break down the barriers to health care and giving more people the chance for healthy and productive lives. Over 40 years, we have reached out across the country with doctors and quality care, showing that we not only expand access to care, but do it cost-effectively. Our health centers save the healthcare system up to $18 billion a year by keeping people healthy and out of costly emergency rooms. Today, together, we provide primary care and preventive health services to 17 million uninsured and medically underserved people in all the 50 states, in Puerto Rico, the District of Columbia, the U.S. Virgin Islands, and Guam. And we stand ready to do more. Access for All America is an ambitious plan. But our health system is under stress. Chronic disease is on the rise, healthcare spending is exploding, shortages in the clinical workforce are expanding, and insurance coverage alone is not enough to address these critical problems. So what will it take for America's health centers to reach 30 million people over the next 8 years? First and foremost, our health center program must be reauthorized by Congress in order to protect the core components of our model of care, including our patient majority boards. Also, to become the healthcare home for nearly twice the number of people we currently serve, we must escalate revenue growth over the next 8 years. Funding will be needed for key purposes: annual base grant adjustments to cover increased operating costs and patient loads at existing centers, establishment of new and expanded access to care in high-need communities not currently served, provision of services such as mental health, oral health, vision, and pharmacy services at every health center. Access further dictates that we work to protect Medicare, Medicaid, the PPS reimbursement mechanism, S-CHIP, and all of the hard-won gains we have made these past 40 years. Second, we must address the alarming shortage of primary care doctors, nurses, pharmacists, dentists, and other health professions in our medically disadvantaged communities. Our access plan calls for increased support for vital primary care workforce training programs, including the National Health Service Corps. We must also step up to grow our own dedicated and committed workforce through mentoring young students and partnerships with the medical and education communities at all levels. Third, access demands that we secure the capital financing to support new facility construction, as well as renovation and expansion of existing facilities. Many health centers are already bursting at the seams with the influx of patients, and many of our buildings are showing their age and are in desperate need of a facelift. But in addition, dedicated funding streams will be needed to develop and acquire health information and management systems to maximize quality. And finally, Together, we must accelerate and strengthen our support systems, aligning sources for education, research, and technical assistance in NAC with the goals of our access plan and in collaboration with our state primary care associations. All of our health centers must have access to the tools needed to excel in both clinical and operational practice. In all, we face a huge challenge ahead. Each component of the Access for All America plan depends on the success of the others. It will take a solid commitment from all of us working together to move this plan forward at both national and state levels. I am pleased to report that some of our state primary care associations have already moved forward and developed state-specific access plans based on their unique needs, environmental circumstances, as well as opportunities and challenges that arise from state health reform. But each and every state must develop its own individual access plan if we are to succeed nationwide. And it all begins today, reaching out to lawmakers, telling our story, and mobilizing the grassroots in support of our health center programs. It also begins right in our health centers, excelling in what we do and showing this nation the vast potential of a community health system that can reduce disparities, improve health, and expand access, while at the same time achieve cost savings in health care. Together, we can make it happen. With the nation focused on health reform, and as the presidential candidates formulate their health care plans, the timing is right to make the case for our community health system. Our model of care can help address the needs of our country, but we must do it now. We cannot wait until a new administration assumes office in January and a new Congress is sworn in. But you may be wondering, what can I do? How can I contribute to the success of the Access for All America plan? To answer that, I've asked 3 of my colleagues, dedicated health center leaders in their own right, to give their personal perspectives on what we can do as consumer board members, clinicians, and health center staff to make access a reality. I am proud to serve you, and thank you for your support of the National Association of Community Health Centers.